Hi, this is Renee Mock, the Director for Bismarck-Burley Public Health. Welcome to the tutorial to complete online registration for COVID-19 vaccine. We hope this tutorial is helpful for you to complete our registration form. And as always, if you have any questions, feel free to reach out to our department at 355-1540. When you click on the link provided to you in your email, you will see this screen show up and you can start filling in the information that it asks for. You will see that there's a red star next to the information that's required for your first name, middle initial, last name, mother's maiden name. You can type in the applicable information, get to race, and there will be a little arrow here you can select, and that will provide you with the drop-down menu. You can choose whatever applies to you. The same is for ethnicity, occupation, date of birth, and gender. You'll always see when there's a little gray arrows on the side, that means that there's a drop-down choice available. Please put in your email address and then retype that email address. You will get future notifications and appointment reminders and confirmations via this email address. You put in your phone number and your phone number type, your address, and then your county, and you hit save and continue, and that will take you to the next page. You will see the message here that states the vaccine is being provided to you at no cost, but insurance will be billed for administration. We are not billing administration costs at Bismarck-Burley Public Health, so please note that you do not need to complete any information on this page outside of selecting insurance type. You do not need to upload your card or put in any additional information. You will see that you have a drop-down menu available as well. You can select private insurance, Medicaid or medical assistance, Medicare, or no insurance, whatever applies to you. Make sure that it's highlighted in blue and select that choice. And then you can put forth the save and continue, and that will generate advancement to the next page. At the top of the page, you can view fact sheets for both the Pfizer and Moderna vaccines by clicking on these links. Once again, a reminder that you must complete all fields again with the red star, and most of the areas on this page do have a required field to fill in. So you can select first, is this your first or second COVID-19 vaccination? For most of you, it will be first, so you click first. Do you have any of the following chronic health conditions? Yes, no, I don't know. If you hit yes, it will put forth a text box where you can type in any information that you want to provide. So if you have cancer, you would just type in whatever information, or heart disease, to provide that information to us. The next question is regarding severe allergic reactions to food, medicine, or other. If you select yes, it will once again generate a text box and you can type in additional information. If you have a food allergy or any type of allergy you want to have listed, you can put that in that box. The next question is having a bleeding disorder or blood thinners. If you are taking blood thinners, you would want to note that in the additional information. Also, have you received antibodies or convalescent plasma as part of COVID-19 treatment in the past 90 days? This is a question that we ask. If you have received that within the past 90 days, you will not want to be getting your vaccine at this time. You'd want to wait till the 90 days have passed to make sure you're outside of that time window. So if you hit yes, it'll once again generate that text box to provide additional information. But you can hit no, and that'll allow you to move on to the next question. If you're pregnant or breastfeeding, and then it asks, have you tested positive for COVID? If yes, when? If you have tested positive, if you select yes, and you put in additional information, 3 months ago, let's say, you can type that information in there. The next question at the top, have you previously received a COVID-19 vaccine? If yes, which one? For most of you, since this is your first vaccine, you would hit no. If you do have another dose that you have received in the past and you hit yes, it will then generate a text box. So if you received Moderna vaccine, for example, you would put Moderna in this text box that's available. The next question, have you had a severe allergic reaction to a previous vaccine or any injectable therapy? And if so, you want to specify. This will help us determine your waiting period following the vaccine. There will be a 15-minute waiting period if you have had a severe allergic reaction to another injectable therapy or a vaccine in the past. We will have you wait 30 minutes following administration. So this is an important question that you want to note. If you have had an allergic reaction, let's say that we had a flu vaccine reaction, we would want to notate that here. Otherwise, you can select no and move on to the next question. If you're immunocompromised or taking medications that affect your immune system, you can select yes or no. Do you currently have a fever? Yes or no. And then have you received any other vaccine in the past 14 days? Once again, this is a question that we would need to know, because if you've had a flu vaccine, pneumonia vaccine, or anything along those lines within the last 14 days, we would want to wait to give you your COVID-19 vaccine until you're outside that time period. So you can get through all of those questions and then at the bottom hit save and continue. And then you can select the desired vaccine for each patient. We are unsure which vaccine will be available during the time that our clinics are scheduled, but if you have a preference, one versus the other, you can select either one. If you want, it doesn't matter to you, you could select both. The only time it would matter here is if you have received one dose and now you're coming in for your second dose, you have to make sure that it's of that same line. So if you received Pfizer originally, your second dose must again be Pfizer. And then your consent for vaccination, we need you to have you checkbox prior to being vaccinated. And this allows us to communicate with you on email and appointment reminders. And then if there's an authorization to release medical information, that is what this box is for. You do not have to check that box, but if you are okay with us releasing your information into our North Dakota system where we track immunization records and such, that would be the applicable authorization for that. You can sign your name and you can use your mouse to sign your name, or if you have a touch screen, you can also use your finger to sign. If you prefer to type your name, you can click type your full name and type in your information. And then it'll request that if it's you that's filling out the form, you'd hit self and it generates your name, your first and last name. However, if it's someone else that's completing on your behalf, if it's a spouse, for example, you would select spouse and then put in their name. You would type in that they are filling it out on your behalf. You would also want to select save and continue, and it will allow you to review your details to make sure that you completed everything accurately, and then hit save and continue, and it will take you to a time to select for your appointment. So you can see each time slot and how many appointments are available during that time. So we're going to select 1:15. There are 15 appointments available. You can scroll down to the bottom and hit save and continue. And you will get a message that says, thank you for registering. You are confirmed and your appointment has been scheduled. We hope this tutorial has been helpful for you. And once again, if you have additional questions, feel free to reach out to us at 355-1540. Thank you.